We are at the Florida Orthopedic Institute at the Citrus Park location, having the course done with about 22 people. My name is Afonso Castro. I'm a physical therapist. I've been practicing for over 20 years. I've been using MSK Flossing for a little bit, almost 2 years with good success. This is my second time taking the course. I'm getting enough practice so I can take the level 2.
My name is Ricardo Hidalgo. I'm a physical therapist, manual therapist certified with Kaltenborn and Stanley Paris, and I have been working here in USA for more than 25 years.
All right, so your fingers should be tingling right now, right? And then this is for television. Instagram.
I have used the flossing very successful with plantar fasciitis, frozen shoulders, and I had great results. People coming with a lot of pain, a lot of dysfunction, and having immediate results, and pretty much getting patients pain-free and going back to normal routine without any problems with that. So that's pretty rewarding.
So I do want to get that down. I don't have to come all the way to the nail. I mean, the mobility on this fascia close to the nail, it's almost nothing.
This is not the first time that you're taking this course, right?
No, sir.
Now, I could end right now, just kind of waste the rest of the band, or just, if I feel like I have time, I just use the whole thing, and then I tuck it in. I leave my quick way out. Okay.
What makes you to come for the MSK Flossings? Why you decided to come here?
I worked with somebody who was trained in it and showed me. I had a patient that came in that had a tricep tendon repair 6 weeks post-op from a different doctor than what I worked for, had already gone through typical therapy that I would have done with her as well in the early post-operative period, and she had a significant contracture at 90 degrees. I did some of the traditional techniques that I normally would do, joint mobilization, soft tissue, patient education, and I went ahead and did the MSK flossing, at which point, through over a 4-week period, her ulnar nerve symptoms completely resolved. Her elbow range of motion went from 90 degrees to 135 degrees, and her elbow extension was -2. So now she was probably 10 weeks post-op at that point in time. We avoided a surgery that the surgeon and her were on board with 4 weeks before, and she was a very, very happy patient when she left. So learning it more specifically from you guys is going to help me be able to open up the amount of patients that I'm going to be able to use this for in the clinic, because now I understand it a little bit better.
Most motion into, adduction, abduction of the thumb.
And I have some neuro patient, I have like MS,
Mm-hmm.
I have problem walking, and I start treating, and I say, let's see how you walk with this, do the lower extremity, treat both sides, and it has some spasticity, and the patient immediately said, I feel better. How much? How much what? How much is the band? I want to buy it right now. So it's like, wow, that is good. I find out that many patients, after you do it, they really want to buy the band immediately. You teach them how to use it, you fix their problems, and they're really interested because you have quick result, and sometimes the patient can treat themselves and they can continue having this better outcome without having pain.
We only see orthopedic patients at the FOI facilities. All orthopedics from the shoulder, knees, toes, fingers, but only orthopedic patients. Pre and post surgery as well. So we had football players, baseball players. I've had Major League baseball players. I've had professional football player.
Very good. It's very informative. It's a great tool to have in your toolbox just to be able to bring something else to the table for your patients.
All right, thank you.
Okay.
Flossing is, I'm using because it's simple, it's efficient, and I have a very good result with the patient.
It's really amazing how this MSK flossing band, have been improving the life of the patient and my life, because I feel better when I see patients that they like the therapy and they walk happy when they leave the office.